Let's get started then with this first webinar from the Down Syndrome Connect Registry. My name is Joaquin Espinosa. I'm privileged to serve in this team running the DS Connect Down Syndrome Registry in collaboration with our colleagues at the National Institutes of Health. And I'll pass the virtual podium to my colleague, Dr. Angela Rachubinsky, who will be doing some introductions today. Angela?
Wonderful. Thank you all. Welcome to this, our first quarterly webinar for DS Connect. I'm going to just start by sharing my screen here. And the first thing I did want to point out for our friends that are attending and need the translation is that we do have this translation into Spanish button right at the top corner of the screen. So overall, for everyone else, if you have questions at any time today, you can go ahead and submit your questions using the Q&A button at the bottom of the screen. So you might actually have to click 3 little dots to see that option. But also the session's being recorded, and we'll go ahead and send out an email to all of the registrants when it's posted here shortly. All right. So overall, this webinar series brings together DS Connect participants and researchers to share updates and insights. So today we are thrilled to have Dr. Anna Esbensen and Dr. Michael Rafii with us. Many of you know them as longtime researchers in the Down syndrome community, and they're also active users of DS Connect. So before we get to that, though, I wanted to take this opportunity to give you a brief tour of new features that have been added to the DS Connect website. So there's an updated look and feel to the whole website if you've had a chance to get on it, but I did want to highlight some of the tabs across the top. So you can use these tabs to learn, just about DS Connect, about the history, check out the FAQ page. The news and events is fun. So this is where you can check out upcoming events where you can connect with our team, buddy walks coming up this time of the year. On the resources tab, you can use this to access links, so to community resources and health guidelines across the lifespan for all ages of individuals with Down syndrome. Next, we can look at the research tab. So in the first one here, you can see research studies that are collaborating with DS Connect for recruitment. And scroll down through there, you might see some changes to this, but in the near future to make studies that are relevant to you easier to find. But on the second tab, or second drop down of that, you can also link directly to clinicaltrials.gov. And so this helps you search by state or even an age range here, or you can just link out directly to clinicaltrials.gov. But this will give you kind of a broad view of all research options available to you. And then the last tab, if you're a researcher joining us today, you can see the new options here to promote your research study through DS Connect. You can also contact us to request a letter of support or even propose a new survey. So, but this quarter, we have really focused on improvements to make the participant experience kind of more user-friendly. So I can show you that here on the dashboard. So you can see I've logged into a test account just to show you a little bit of how this works. So the first thing when I create a test account, I was prompted to acknowledge the consent form and complete a basic health survey. So this has a number of yes/no questions. Participants tell us it typically takes 15 to 30 minutes or so. But based on my answers to this first question, other surveys populate for me to complete. So these additional surveys are, for the most part, designed to be short, but still capture, really important details that are useful to investigators who might want to use this data or use this information to help recruit into their study. So, for example, you can see that, in the basic health survey, there was a question about sleep apnea. So I said, yes, I had a history of sleep apnea. So it asked me to complete the sleep survey, which I did back in June. But the interesting thing that I wanted to point out over here is then once you complete these additional surveys, you get access to community data. So I can click on this and then see the visualization about how my answers fall in response to the greater DS Connect cohorts. You can see, about a third of participant reported information also report a sleep problem in this cohort. So again, this is just test data, but this isn't, if you're interested in that, a great way to kind of explore on your own some of the other information. And your answer is always highlighted in here. If you have questions or you get stuck at any point, you can easily use this help tab and reach out to us in a few different ways. So you can certainly send us an email. You can schedule a video conference call. So if you're just really kind of getting stuck in maybe a login spot or have a question about how to answer one of the survey questions, you can schedule a video conference as early as that same day with a coordinator and set up a Zoom call there. So that offers you more dedicated support. And then soon we'll have this live chat function available as well. You can also use this report and issue button if you ever find something that just doesn't quite make sense to you, you think that we need to know about, or you just have a suggestion and just want to submit it but don't necessarily need a response back. You can certainly do that, add screenshots. We take all of these suggestions very seriously. You can also go down here and check out any of the frequently asked questions. If you do just have a quick question, hopefully you can get your answers there. So with that, I'm going to introduce our first speaker. So this is Dr. Anna Esbensen. She is a Sonia Oppenheimer Endowed
Let's
Chair.
pause first before we get the translations. I think I saw something in the chat.
Thanks, Anna. We just wanted to make it
Sorry.
clear, like some people are having issues getting the translation. So again, a reminder, at the bottom of your screen, you should see a little globe that says interpretation. If you don't see it, there should be a button that says more, and it should pop up there. And then once you click interpretation, you'll be able to select to listen in Spanish. And then you'll also want to select the mute original audio so that you are only hearing in Spanish and not hearing both languages at the same time. Thanks, Angela.
We can give just a minute to let everybody get set up there.
Angela, those instructions were given in English, so may I give them in Spanish?
Absolutely. Would you like me to go navigate back?
No, you're good. Para los participantes que hablan español, aquí abajo en la pantalla, a la derecha, hay un globito que dice more, o puede haber un globito que tiene un llamado de interpretación. Hay que cliquear ahí en ese globito y seleccionar interpretation, interpretación. Y uno ahí selecciona el audio en español que tenemos aquí a Mari, que está traduciendo en tiempo real. Thank you, Angela.
Thank you, Dr. Espinosa. Okay. All right, so I was introducing Dr. Anna Esbensen. She's the Sonia Oppenheimer Endowed Chair and a professor of pediatrics at the University of Cincinnati College of Medicine in the Division of Developmental and Behavioral Pediatrics at Cincinnati Children's Hospital Medical Center. So Dr. Esbensen studies the lifespan development of individuals with Down syndrome and provides clinical services to families of children with Down syndrome through the Jane and Richard Thomas Center for Down syndrome there. She serves as research director at the Thomas Center and in the Division of Developmental and Behavioral Pediatrics. Her research focuses mostly on physical and mental health of individuals with Down syndrome and then their impact on behavioral and cognitive outcomes. She's received and sustained NIH and foundation funding with a focus on evaluating the appropriateness of cognitive outcome measures in children with Down syndrome and conducting randomized clinical trials in children with Down syndrome targeting sleep and ADHD symptoms. So her service and scholarship has been recognized with fellow status of the American Psychological Association and the American Association for Intellectual and Developmental Disabilities, And her research has been recently recognized at the 2025 Down Syndrome Congress, where she was awarded the Puchel Josem Research Award and the John Jacobson Award for Critical Thinking from the American Psychological Association. So on top of all that, she's very special to us. She's served as chair of the DS Connect Research Review Committee and continues to help bring her valuable experience and perspective with that committee. So without further ado, I will pass to Dr. Esbensen.
And so thank you, Angela, and just confirming that my slides are viewed correctly.
Yes.
Perfect. Okay, so I'm going to talk today just about how families can get DS connected and why. Mostly just sort of share how we can all make that communal impact for improving outcomes for individuals with Down syndrome. And I'll get my mouse to work. It's going to work because the Down syndrome field is really nicely connected. A lot of the Down syndrome organizations, if you did not know this, there's a whole Down syndrome consortium that's led by the NIH, where all the organizations that you could possibly think of, and if you think of another one, then get them invited because they'll likely collaborate. So a variety of the institutes at NIH, these organizations that are national and or international supporting individuals with Down syndrome are connected, as well as self-advocates on the board. So our field is really well connected in the field of Down syndrome. And so now we want to make sure that all of the individuals are also feeling like they're also part of this whole larger consortium and are being connected, because research is a team effort. If we're trying to improve outcomes, no one person can do that on their own. So here's just a schematic of the larger team effort that's engaged. So we have the funders. So they, like, you know, I give the NIH a lot of credit because it's DS Connect, but there's a lot of other foundation and federal and internal grants to those institutions that are all funding science. But in the field of Down syndrome, a lot of it's coming from the NIH. That's also going to be where we're looking at DS Connect and making sure that that's being done ethically, or they're making sure the ethics are done appropriately. They're also helping engage stakeholders and engaging new researchers to the field of Down syndrome. The researchers are then also one cog. They don't work on their own. They have to then design those ethically designed studies, but also engage participants and share the information back so that we're trying to improve those outcomes. There's other players who are also engaged in terms of the medical providers, clinical providers, schools, advocacy groups, legislators, and pharmaceutical companies. So there's larger organizations that are also engaged, and also the families and the individuals are also informing the research questions and participating in research and benefiting from those research findings being shared back with them. So research is a team effort, and DS Connect is working to connect the researchers and the families and individuals about different research opportunities through funding from the NIH. So again, it's a bigger cog. And so our goal is to help families understand how they can be part of this cog and not just feel like an individual that's siloed, but how they can be part of this larger consortium organization team effort. But before we go into what some of the ways that people can get involved are, I want families and individuals to know that what is being presented through DS Connect has gone through research review. We are making sure that everything that is being shared through DS Connect is appropriate. And I'll go through all the different ways that we're doing things to make sure that's appropriate. But here's the one line of engagement that's being involved with DS Connect. There's stakeholders from the National Institute for Child Health and Human Development. There's the DS Connect supports in Colorado. DS Connect Review has family members, people engaged in clinical research, and people engaged in when I say clinical research, I mean we're also clinicians, but then people who are doing research who are not necessarily clinicians. But then also all these individuals, or many of these individuals, might straddle multiple roles by being family provider or family members themselves, and also researchers. So people are making sure that we're providing information that is ethical and rigorous before it's being presented through DS Connect to families. So we're overseeing the registry data in terms of protecting the interest and the privacy of participants. All the requests that would be made of DS Connect to say, hey, I have a research study, can you share this out to families? We're reviewing all those requests to make sure that they're appropriate. So any study notices that are going out, or any requests to engage families for or participants for recruiting, are also being reviewed. We're also then reviewing the publications that people who then use the data or who are recruiting, we also ask them to give information back so that we can see what's the productivity, what are the products, what are the findings that are coming out of that those efforts. So we can see not just what's coming out of the registry, but also what's the value of this DS Connect in terms of those number of publications. So this is what I wanted to share in terms of when you see something on DS Connect, we have made sure that it is good quality. We are reviewing it for its scientific merit. Is it something that is important to families or to individuals with Down syndrome? Is it being done by somebody who has good qualifications? We have a lot of people who have good intentions, but we want to make sure that their research is really going to be mindful of the phrasing and the wording that's going to be respectful of our families and of our individuals with Down syndrome. And we're not doing this to be exclusionary. We're definitely going to be providing guidance as needed to really engage those investigators to make sure that they're learning from this process. We want them to be doing research that's improving outcomes for our individuals and for our families. But we want them to be doing it in a way that is respectful. We're ensuring that everything has been reviewed by the institutional review boards and that has institutional or organizational support from their environment. So is that project being done ethically? Not just that it's good questions, but are they really making sure to get good consent from individuals and families? We also look at the safety of the study in terms of potential benefits or risks to the individuals in DS Connect that could participate, making sure that we're using person-first language, that the teams have any behavioral strategies in place to maximize participation and to maximize the engagement of the individual and their families. So we want to make sure that there's participation is balanced in terms of the effort and the compensation, that we're not having something that's too coercive or that's underrepresentative of the effort being put forth by a family or an individual. And then we're also looking at what kind of funding is provided to that research study that wants to engage with DS Connect and to the DS Connect families. So we're really, again, balancing that research review and making sure it's rigorous and ethical and appropriate and good quality research coming to the families in DS Connect. But we also are providing that balance of support for those newer investigators to really encourage them to continue to do work in this field, but making sure it's well done. So now I wanted to reiterate what Angela was doing in terms of like she's showing how to get DS connected. So going to DS Connect website, and then there's that research tab that she showed, but she'd already been signed up. And so I haven't signed up. So this is what you'll see if you haven't signed up yet in terms of going to that research tab. So then you might have to click log or join in to join DS Connect. You can also go scroll down to see those research studies as she was showing on that prior slide. And I wanted to reiterate that there's also all those wonderful other resources and information that's on this registry website. So it's not meant to just be how do we get people connected to research, but how do we also use that research information to give back to families? So making sure that you'll see that these things are going to be updated with new news and events or new resources or new findings that are coming out. So it's something that is not just like one and done, but something that you can keep coming back to see what the updates are. And with any research, it is your choice. So there was a spattering of studies, and it's going to be, like we said, there's going to be continuing advancements on how you can find something that's appropriate for the age of your child or your adult, or the individual themselves can find something that's appropriate for them, or as a family member that you can participate. So there'll be that tailoring, but there's also going to be a variety of options. And so, engaging in research, some things are completely, within someone's wheelhouse, and some things like, no, I really don't want to do that. So just know that there's a variety of options, and it's always going to be your choice or the individual with Down syndrome's choice. So there are going to be surveys that are just, one and done, or like, over time, just something you can do on the computer. There might be survey about your experiences or survey about your thoughts or your feelings about certain situations. There could be ones where you're answering questionnaires about health concerns for the individual, like you're seeing in the DS Connect basic survey. There could be ones where they're connecting you to either they're able to mail you some wearable technology, or you have to go to a local location to get that wearable technology, but they could be recording data from activity trackers, so Fitbits or probably smartwatches at this point. So there's going to be something that you can be not just responding to surveys, but you could be, having something that's actively tracking your mobility. But then there's also going to be clinical trials. So something where we're trying to test, does an intervention work? And that intervention could be a drug, or it could be a behavior therapy, or it could be a workout regimen. So when you see clinical trial for an intervention or treatment, it's something that we want to see if this improves outcomes. But like I said, there could also be clinical trials of medications to see if they are, safe in this population, or if there's one that is already safe or FDA approved, but we want to see how it works in this population specific to Down syndrome, since we were typically excluded. So there's going to be lots of opportunities for you to see what's going to be appropriate for you and or your family and or the individual with Down syndrome for how to participate in an include study. And I probably also include that there's also, I got the blood vials down there, but there's also blood draws. So there might be something where there's a one-off, just like a blood draw to provide a sample. So all of these are different options, and want people to make sure that there's lots of different ways to get engaged and finding out what's going to be most appropriate for you and your family at this time. And then you come back in a couple of years and see what's available at the next time. And wanted to share several opportunities that have been either current or past, so that you can get the breadth of the types of studies that have been posted on DS Connect. And so this is where I got asked to present, because as the former research chair, I had the legacy of the information of the types of studies that we had previously reviewed. And so you'll see that these are the names of the principal investigator, where they're located, the title of their study, and then the age range for the participants. And so here you'll see that these studies for the child or pediatric population range from a focus on mental health and physical health and vaccine hesitancy. So it wasn't looking at does the vaccine work, but it was more the vaccine hesitancy, and also social health determinants. So again, even within that child age range, a wide variety of opportunities for engagement. And so some of these were developing interventions before they became interventions. Some of them were looking at like what should be a target for an intervention. So a variety of opportunities that we had present in DS Connect. And then amongst adults, again, a variety of opportunities that I think these were all, can't remember if any of them are still current, but these might have been older studies. There's probably newer ones as well. But these ones are looking at how we improve measurement of clinical or cognitive outcomes, how we also track decline, and how we engage participation in research studies. So looking at how do we improve engagement, looking at how do we measure change, and also how do we measure declines, because that is another important part of just making sure we're doing good measurement as we try to improve outcomes for our adults. And then there was a variety of clinical trials. A lot of them are on sleep, but that's just who was submitting initially for research funding. But we also have clinical trials that, so from pediatric to adult populations, also focused on improving skin conditions or immune functioning, also looking at trying to prevent the decline in dementia with dementia or Alzheimer's disease. So again, a variety, if you're interested in clinical trials of, and even the sleep ones, some of them were medical interventions, some of them were behavioral interventions, and there's other ones that are currently going that are a device intervention. So there's, even within you focusing on sleep, there's a lot of different ways to get involved in a clinical trial that are different levels of or might be appropriate for your family.
Anna, there is a request to slow down a little bit for the interpreter to keep up.
I will do my best. Thank you so much for that reminder. I thought I was doing a good job being slower, but I'm still too quick. So wanting to share with families what's the impact by the numbers of what people are doing when they're DS connected. So in terms of include, as that include mechanism or for funding for Down syndrome, there's been almost 400 projects that have been funded. There has been over 400 publications that have come out of it, so that's fantastic. DS Connect has been going for 12 years and has connected over 100 studies to families. So those are wonderful numbers. But I want to know more as a parent, like, who is this impacting? What's the impact? When did it being impacting my family? Where and why? So numbers are great, but I wanted to share more about really when you get DS connected, what the really impact is for you or for the DS community. So who are we impacting? it's not just the individual with Down syndrome and improving outcomes, it's also the perspectives of all the people around them for what we might want to improve. So the family might want to have greater improvements in daily living skills for their individual with Down syndrome, or greater inclusion in the community, or greater quality of life. So the impact differs by who we're asking. The teachers might want to see more improvement in terms of what we can do academically, or compliance with the classroom, or school behavior. So again, there's studies that are looking at all of these different topics. And so we're always trying to make sure that the impact is going to be answering questions for different people. Myself as a therapist, or my colleagues might also want to know more about how we can improve language development, or motor milestones, or therapeutic goals. We have lots of Down syndrome associations or affiliated groups that are looking at how can we improve programming. Again, those are also items of discussion through Include Funding and DS Connect. Clinicians, again, like myself, are focused on improving mental health and how can we improve measurement of mental health so it's appropriate in this Down syndrome population. The physicians might be asking about improving physical health outcomes. That's a lot of the focus, but also how can we improve progress towards milestones or improve the medication options that are available. And the individual might have different questions about wanting to improve their connections with peers, with their vocations, and with their romantic relationships or their partnerships. So again, all these questions are being asked, so we're not just having an impact on one specific individual, but on also all these individuals who are asking questions. As I said, that the physicians have a lot of the questions about the medical system. So knowing like what we're trying to impact is a lot of these we're working to improve outcomes across a host of medical conditions across the human body. So know that it's not just one condition of Down syndrome, but we're trying to improve all the medical conditions that might be associated with having Down syndrome. When are we trying to impact outcomes? Across the lifespan. So just because you're coming to this maybe as an adult and you're seeing all the studies about kids, there are studies about adults. Or you're seeing a lot of studies about adults, there will be other studies coming in out about children. So knowing we're trying to improve outcomes across the lifespan, and there's research opportunities at all those stages of life. And then where we are almost all across the United States. So in yellow here is where represents the states that have a Down syndrome center at them. So those sites are likely engaged with trying to improve outcomes either through DS Connect or Include, or sharing that information out to families. In blue stars, I have tried to approximate where all the clinical trial sites are. I couldn't capture all of them because some sites are really part of a much larger consortium. So these are the ones that were more specific on smaller Down syndrome trials. So know that wherever you're listening, I'm hoping if it's in the United States, there is a clinical trial site that is close to you that may or may not have something that you're interested in. But really, this is where we're doing the studies, but the impact really is global in terms of partnerships that we all have with other international researchers, or sharing information with our clinicians or our scientists or Down syndrome associations at other countries. Because I showed you the Down syndrome consortium, the Down syndrome field is very well connected. And then the why we're getting DS connected to improve outcomes. You all have your own personal picture for represented, but that really is the why for who we're trying to improve outcomes for. So before I end, I just wanted to share two surveys. You can go to the DS Connect website and see more, but these were two studies that had emails that were more online surveys to be able to be more available to the people that might be on the webinar, because you're not all here in Cincinnati with me. But these are two online surveys that are either for children or for all ages, and either take a picture of the QR code or just note those emails, and you'll be able to get connected to those research surveys. And then these are my DS connections. So everyone else's DS, we want to get you DS connected, but these are my DS connections. So the federal funding and also foundation funding, my Down syndrome coordinators who are greatly connected. I lost my slides, but there's lots of collaborators across the states. So apologies for the slide clicking out, but just know that we all want to be DS connected, and I hope you'll join me in being DS connected. So apologies to the interpreter.
Wonderful. Thank you, Dr. Esbensen. All right. Next, I would like to introduce Dr. Michael Rafii. He is the medical director at the Alzheimer's Therapeutic Research Institute and professor of clinical neurology at the Keck Institute of Medicine at USC. So as a physician scientist, Dr. Rafii focuses on developing novel therapies for Alzheimer's disease, including the genetic form of affecting individuals with Down syndrome. He's the principal investigator of the NIH-funded Alzheimer's Clinical Trials Consortium for Down syndrome and leads several clinical international trials across an extensive network of academic sites. All right. With that, Dr. Rafii, go ahead and start.
Thanks, Angela. Can you see my slides okay?
Yes, thank you.
Perfect. Okay, so these are my, let's see if I can get this to them. These are my disclosures. So I'm going to talk to you today about why people with Down syndrome are at such high risk for developing Alzheimer's disease. Is Alzheimer's disease in people with Down syndrome the same as other forms of Alzheimer's disease? And are there any treatments for Alzheimer's disease in people with Down syndrome? And this graph shows the population of people with Down syndrome in the United States for the past 60 years. And the different age ranges are indicated by different colors. On the bottom, you can see the different years that the data was collected from. And in the far left, you can see that in 1950, there were about 50,000 people with Down syndrome in the United States. And in 2018, you can see that there were over 200,000 people with Down syndrome. And if you look at the different colors, you can see that the number of people over the age of 20 has increased dramatically, so that there are now a significant number of people in the 25 to 30-year-old, 30 to 39, 40 to 50, and so on, that really people didn't survive that long with Down syndrome back in the 1950s. And this is due to excellent healthcare and access to healthcare and new treatments becoming available. However, with this increase in age and lifespan, we see that there is a high chance of developing Alzheimer's dementia. The average age when dementia is diagnosed in a person with Down syndrome is about 55 years old. And Alzheimer's disease is now the leading cause of death in adults with Down syndrome over the age of 35. Why do people with Down syndrome have such a high rate of developing Alzheimer's disease? And on the left is a picture of a healthy brain in an individual from the general population who on the right then develops Alzheimer's disease. And you can see the main difference is that the brain of a person with Alzheimer's is much smaller, and there's shrinkage of an area of the brain called the hippocampus, which is involved in memory. And in 1906, a physician named Dr. Alois Alzheimer actually identified plaques, you can see here on the bottom right, that are in the brain that he believed caused this shrinkage of the brain and also the symptoms of memory loss. And it wasn't until the 1980s when pathologists looked at brains from people with Down syndrome and saw that they also had the very same plaques in their brains. And why do they have the same plaques? As you know, people with Down syndrome have trisomy 21, an extra copy of the 21st chromosome. And on the 21st chromosome is a gene called the amyloid precursor protein gene. I have the genes indicated here in different colors, but each gene encodes its own protein. On the 21st chromosome, there are about 300 genes, and there are about 300 proteins that come about. One of them is this APP gene. And so people with Down syndrome make an extra copy of the gene and therefore make an extra copy of the protein. So I've taken the prior image now, and I've shown it to you here in this circle on the right. And the result of having that extra copy of that gene is that this extra protein is produced, about 50% extra amount. And this protein, amyloid precursor protein, gets cleaved. And the cleavage results in a smaller protein called beta amyloid to be produced. And it's this beta amyloid that results in plaques, the same plaques that Dr. Alzheimer saw. And these plaques are necessary to diagnose someone with pathologically having Alzheimer's disease. And it's because of this extra copy of the APP gene that people with Down syndrome are producing plaques at a much younger age than the general population. There's been a lot of research now done with a technique called amyloid PET scanning that allows us to look at the brain with a special camera and to actually see the plaques. And on the left here, on the bottom is the age ranges, and the different lines, the blue lines, are people who had this PET scan done who didn't have amyloid plaques in their brain. All of these individuals have Down syndrome. And then in the red are individuals with Down syndrome who did have plaques as seen with this PET scan. And what you can see is once you get to about the age of 35, the number of people who have amyloid plaques in their brain increases. And with the lines, you can see they had multiple scans done, and you can see that there's a dramatic increase in the amount of amyloid, so that by around the age of 40, virtually everyone is in the red, which is an increased amount of amyloid in the brain. Now, you saw that I have this arrow here on the left at age 35. That's when we start to see the buildup of amyloid on the PET scans. On the right is the age where dementia is diagnosed, where people really have a lot of symptoms from their Alzheimer's disease. And these symptoms can be forgetfulness, but also just trouble in general, thinking, communicating. And you can see that this is around age 55, as I mentioned earlier. So I've told you now that plaques are seen on PET scan around age 35, and symptoms show up around age 55. So there's about a 20-year lag between when those plaques show up in the brain and when the symptoms of dementia show up. And that 20-year lag is the same that we see in other genetic forms of Alzheimer's disease. And it's also what we see in the general population, where in the general population, people may have plaques in their brain in their 60s, but don't show symptoms until they're in their 80s. Or they may have plaques in their 50s and show symptoms in their 70s. So there's a 20-year interval where the plaques are in the brain. And we see the same 20-year interval in people with Down syndrome. Given all of this, in 2018, we established a consortium of sites that have expertise in studying Alzheimer's disease in people with Down syndrome. This is called the Alzheimer's Clinical Trials Consortium Down Syndrome. It is really built on an infrastructure that's funded by the NIH called ACTC, which is conducting clinical trials for the general population. And here we're using a lot of the same infrastructure to study and develop clinical trials that are specifically tailored for people with Down syndrome. We have 20 sites around the world, including sites in Europe. Now, the first project that was funded that utilized this ACTCDS network was the Trial Ready Cohort, and this was described a bit earlier. The Trial Ready Cohort is a group of individuals with Down syndrome who are interested in getting involved in research, interested in participating in every 16-month assessments of brain functioning. So memory tests, MRI of the brain, blood tests that would then help us bring to them the opportunity to participate in clinical trials. And TRACK-DS is one of the studies that's listed on the DS Connect registry. We are also very closely aligned with the Alzheimer's Biomarker Consortium for Down Syndrome, or ABCDS. And this is a very large observational study of just aging in people with Down syndrome. But individuals in that study can also volunteer to be part of this trial-ready cohort so that if there's a study that they might be eligible for, they would be given information about it to see if they want to participate and get enrolled. There are 3 clinical trials that I'm going to mention: the ABATE trial, the HERO trial, and the Aladdin trial. And these are drug trials meant to either prevent or treat Alzheimer's disease in people with Down syndrome. Now, before I go any further, I would like to make an announcement that the HERO trial actually has been closed. The HERO trial was a study that was being sponsored by Ionis, and the decision to end the study was based on several factors, most importantly, challenges in participant enrollment. And this study was discontinued not due to any safety concerns with the drug, but rather the study was looking at a drug that was being evaluated in humans for the first time. And this involves a lot of extensive testing and assessments that contributed to much slower than anticipated enrollment. When clinical trials are conducted, there are different phases: phase 1, phase 2, and phase 3. And this study was a very, very early phase 1 study that required a lot of participation from participants in procedures that were meant to look at safety. Many clinical trials that are brought into the Down syndrome population do not have this very early stage testing, and we do not see this being an issue in other studies. Ionis has expressed deep appreciation for the participants, the families, the caregivers, the advocacy groups, everyone who is involved in the trial, and the investigators will, at the different sites, will continue to work closely with the participants and their families to determine what are the next steps as they close this study. But I do want to say that insights gained from this HERO study are going to play a critical role in shaping our efforts. It may very well be that running very early stage clinical trials is not ideal for this population, and we need to refine our study designs and the execution of the studies as we move forward. Here I have the graph of the therapeutic targets that the 2 clinical trials that I'm going to talk about in more detail are going after. So this is the same image that I showed earlier with the extra copy of the APP gene resulting in the extra copy of the amyloid precursor protein resulting in beta amyloid. The 2 studies, ABATE is targeting these beta amyloid proteins, and the Aladdin study will also be targeting these amyloid proteins, these plaques. And the ABATE study is using an active immunotherapy similar to a vaccine, and the Aladdin study is using passive immunotherapy, in fact, one of the FDA-approved treatments. Now, next year, we will be launching a new study that targets the mRNA, the actual genetic cause of Alzheimer's disease in this population, and there'll be more information shared about that at an upcoming webinar. But I did want to talk about the ABATE trial. The ABATE trial is ongoing, looking for participants between the ages of 35 and 50, and it's specifically designed for people with Down syndrome. There is a sister study within ABATE that is looking at the same treatment in people in the general population, but this arm is looking specifically at people with Down syndrome. And there are really 2 goals. Number 1, to learn about the study treatment safety, tolerability, and also if it slows down memory loss and thinking problems. And here I have a QR code if you want to learn more about this study. The next study is the Aladdin study. And the Aladdin study will be testing donanemab. Donanemab is an antibody that is given once a month by infusion. And this treatment is FDA approved for Alzheimer's disease, but it was never tested in people with Down syndrome. And so we are bringing this into a clinical trial for people with Down syndrome to confirm the same effect in people with Down syndrome to ensure that it can be prescribed safely in these individuals as well. And we're aiming to launch later this year. So here I have just a summary slide of the two current studies, ABATE and Aladdin. The ABATE study is sponsored by AC Immune. The Aladdin study is sponsored by us at ACTCDS, working with the NIH, of course. The therapy in the ABATE study is ACI 24060. This is an active immunotherapy similar to a vaccine that targets beta amyloid. The Aladdin study is testing donanemab, which is the FDA-approved drug that removes amyloid plaques from the brain. The ABATE study is a phase 1b/2 trial, whereas Aladdin is a phase 4 study. Because it's FDA-approved, it does not need another phase 3 or earlier testing. The ABATE study treatment is given through an intramuscular injection, whereas the Aladdin study uses intravenous infusion. Both of them are placebo-controlled, and both of them are looking for individuals between the ages of 35 and 50. Now, compared to Alzheimer's studies, which have thousands and thousands of participants, these studies are fairly small. They have 80 participants for the ABATE study and 60 for the Aladdin, and we're expecting a 2-year commitment from the participants, 2-year commitment from the participants and also family members as we run these studies and assess their treatment effects. I also want to mention that the Alzheimer's Clinical Trial Consortium for Down Syndrome and the ABCDS together have a collaboration with individuals from the Down syndrome community. And we have researchers, including myself, as well as individuals with Down syndrome and their family members who meet regularly, meet quarterly, and we review study protocols, consent forms, study documents to make sure that the language is clear, that it's digestible, that it's understandable, and also that it fits with the lifestyle, the active lifestyle of individuals with Down syndrome. And I can tell you that this community that we've built has been very helpful, and lessons learned from the HERO study and all of our studies are brought to this group to help distribute information to any researchers who are getting involved in clinical trials for people with Down syndrome. So in summary, people with Down syndrome develop a genetic form of Alzheimer's disease. And research studies from ABCDS and other groups have shown that this Alzheimer's disease in people with Down syndrome is nearly identical to all the other forms of Alzheimer's disease, where there is an accumulation of beta amyloid plaques in the brain, and then thinking problems and memory problems. There are now FDA-approved treatments for Alzheimer's disease, and this is a conundrum for clinicians who see adults with Down syndrome, where they don't know whether they can or should prescribe these treatments. And our goal is to help answer that question. Our consortium is running these studies in ways that are specifically tailored for people with Down syndrome. And we now have several clinical trials that are either underway or planned. We have another study, a clinical trial targeting RNA against that amyloid precursor protein gene, launching next year, and there will be a non-pharmacological intervention launching next year as well. And I invite you to look at our website, which will have more information about the ongoing studies and the current and the upcoming studies as well. And I also want to end with an acknowledgement of all the individuals who are the collaborating researchers, the folks at ACTC, but also ACTCDS, ABCDS, and the various sites, and all of the advocacy groups, and of course the NIH and the Include initiative that have really helped us reach where we are today and hopefully be able to bring new treatments for people with Down syndrome. So I'll stop there.
Well, thank you so much, Dr. Rafii. It looks like we do have a number of questions kind of coming through. Feel free to put your questions down in that Q&A. And if we don't get to your question, if it's not answered live or on air, we will follow up with you afterwards as well to make sure that we get all of these questions answered if we do run out of time. So going back a little bit, it looked like there was a question that Dr. Espinosa wanted to answer live. So the question was, do surveys and studies mention the requirements of participants with the Down syndrome has to be proficient in English, or if Spanish-speaking participants are welcome? And we've had a few people suggesting that maybe we should be expanding internationally.
First of all, the entire website content and all the surveys after you register, they are all translated to Spanish. So Hispanic or Spanish-speaking participants are totally capable of joining and answering all the same surveys than the English-speaking participants. Anyone, anywhere with access to internet can sign up to DS Connect. There's no a block or some kind of system that prevents somebody, say, from Mexico or Latin America from signing into DS Connect. And then if you have a study in a different country that you would like to promote through the website, send the study to the research review committee, to Dr. Esbensen, Dr. Rachubinsky, and it will be reviewed. It doesn't have to be exclusively a US-based study.
Thank you, Dr. Espinosa.
And I'll just put a plug in the DS Research email, the one with the QR code. So I do have an online survey that's in English and in Spanish, only within the United States because of payment purposes. But I think there's more and more investigators who are recognizing that to be accessible and inclusive in our research, that we need to also include some language inclusion.
And when you go to the DS Connect site and we have the tiles describing the different studies, it will tell you if it's open to Spanish speaking or other languages as well. All right. Dr. Esbensen, maybe you can take this study first and question first, anyone else can chime in. The question is, if you could explain a little bit about how a trial is specifically designed for people with Down syndrome.
It's a big, huge dissertation type question. So there's going to be modifications initially to how we consent. So how we explain a study to an adult with Down syndrome if they're their own guardian. So that's going to be, the first step of modifications. The second, there's lots of different ways that a study can be made to be more accessible and inclusive. Depending on if it's like a motor study and, do we have accessibility to get into the site or the location? The survey questions, sometimes they're like negatively phrased, or sometimes they're not using really respectful language. And so that's going to be made making it more accessible to the parents. If we're doing something where we're doing cognitive testing and we just are giving information verbally, or commands or instructions verbally, individuals might not always understand unless we're repeating it using visual supports. So there's behavioral accommodations that you can make in a visit if you're doing some testing. Going back to the consent, there's ways that we can, again, have some visuals to go along with the consent process so the person's understanding what we're explaining in addition to hearing what we're saying. For people who are new to the field of Down syndrome, they might not use a visual schedule to help someone understand the length of the visit. So even if you're going to come in and do a clinical trial where there's a lumbar puncture and a blood draw, and we're doing some testing and there's a lot of activities, you can still have a visual schedule to sort of show all the activities so the person knows what's next, or if they need to request for a break if it's a longer visit. Making sure that we're putting breaks into visits. So it really is a lot of, changing the environment, changing the, visual supports. So I hope that answered the question. I'm sure there's lots of other different ways that we could provide accommodations that I'm not thinking of, but.
Thank you. Thank you very much. I think that really kind of gives a background on how thoughtful the researchers are when we're trying to implement these studies, and that everybody's always open for suggestions as well. We have a lot of questions in the chat here. Dr. Rafii, there's a question on how is APP being detected right now? Is the blood test viable in people with Down syndrome?
Yeah, so there is a blood test now for Alzheimer's disease, FDA-approved blood test that tells us if you have elevated amyloid plaques in the brain. And it's actually a blood test that takes a ratio of a couple of different proteins. And we have been working on validating that blood test for people with Down syndrome. Others have looked at some of the various assays that are out there. We've been looking at the ones that are FDA approved or going to soon be FDA approved. And we've actually submitted some of our information to support the use of these tests, but they are not available yet. And those blood tests are measuring, again, ratios of different proteins that explain if a person has or predict if a person has elevated brain amyloid.
Thank you. And how about opportunities for individuals in the younger age group, say those under 35? And a follow-up question to that is kind of talking about looking at immunotherapies in the 20s, something a little bit earlier. Is that a direction that research is going in?
So research in the Alzheimer's field is certainly moving in that direction. These treatments that are now FDA approved clearly slow down on large placebo-controlled studies, slow down cognitive decline associated with having amyloid in the brain. If you look at them, they are about a 35 to 36% slowing of decline. And we also see that the earlier in the disease course they are started, the greater the benefit. And so if, especially in a genetic population, since you know there's a high likelihood of developing it, it would make sense to go as early as possible. However, there are nuances to this. For example, when do you actually consider an individual as having a meaningful benefit from starting these treatments? If it's a 20-year-old, how long would you need to treat them to actually prevent or delay the plaques from developing in the first place? The treatments now remove the plaques. And so if you don't have the plaques in place, it really doesn't make sense to use that mechanism of action. The genetic treatments that reduce the conversion of APP to protein, those would certainly make sense to take at an earlier age range. But that's how we need to start somewhere and slowly work our way back in earlier in the disease. But it's going to take a long time, and it's going to take a lot of collaboration with companies and researchers to make that happen.
Thank you. Thank you very much. I know we're getting close to the end of time, just because we had a cluster of questions asking more about preventative care, so or lifestyle changes that individuals with Down syndrome could make in early adulthood that might influence healthy aging.
Well, I can say that the US Pointer study, which showed lifestyle modification does have cognitive benefits. Although there's some data pending at this year's CTAD meeting on the effect of lifestyle modification on biomarkers, it's quite clear that what's good for the heart is good for the brain. And so healthy lifestyle, healthy diet, moderate exercise, avoiding substances that can injure brain cells, I think these are all common sense. But next year, we hope to launch a non-pharmacological lifestyle modification intervention to look at, in an evidence-based way, to look at the effect on the development of Alzheimer's in people with Down syndrome.
Great, thank you.
Angela, we'll take in all the questions, and answer, all of them. But before we run out of time, I wanted you to share this slide. So in the likelihood that somebody on the call has not joined DS Connect yet, there are these QR codes that will take you straight to the English homepage or the Spanish homepage. And then you can always check the FAQs and the help center in the website if you run into any issues signing in.
Thank you very much. I think that is a great note to end on. Thank you all for joining us today. We hope to see you again at the next one.